So my name is Yesenia Castro, and I'm from the Mid-Columbia region in Oregon and Washington. I mainly work on the Oregon side, though, so I'll just throw that out there. Um, so we've been doing a lot of work around collaboration. I was telling some people at my table earlier that a unique member of our community just recently is a his title is Collective Impact Specialist. What he does is basically he's our grant writer for our community, which has been absolutely amazing. I mean, people talk to each other in our community, and I think something that can be both a blessing and something that sometimes is hard is that we're in a rural community, so everybody knows each other. The mayor's kids go to the school, the director, our CCO director is a local doctor, things like that. So we have now Paul, who's our collective impact specialist, who will only write grants for our community where organizations are collaborating. So it kind of eliminates that competition, right, that some people sometimes have, especially in small communities where sometimes numbers are needed for certain kinds of grants. So my specific work is with a coalition. It's the Mid-Columbia Health Equity Advocates, which is specifically for looking more at Latino issues in our community. And so a lot of the work that I do is I'm a community health worker, and I work with a lot of community health workers in our community that have been there for years doing the work. Although I have been doing the work since I was little, officially started really working, getting paid for it 3 years ago. So really my piece in all of this work and all the doctors and school administrators and county and everybody that's talking about what are we going to do because of our community needs assessment is I'm going out to the community, specifically the Latino community, to ask, this is what came out in our needs assessment. Is it true? And if it is, what does it look like? So the housing needs. Yeah, we know there's housing needs, but what does it look like to you? And then starting to have those conversations, and then as community health workers, me and my colleagues kind of go to our decision makers or county administrators or whatever you want to call it, the big guys, right? The ones with the alphabet soup at the end of their names, and tell them this is what our community said. What can we do and how can we work together to change policy? That's kind of the end goal with the coalition, is really wanting to change policy. Some of the resources and capacities that have helped this out is, of course, our collective impact specialists, but also getting our decision makers to be actively engaged. It's really hard to, especially with schedules, sometimes it's really hard to get like our mayor to participate, but having the stories that we can share and the data and the people involved has been very powerful. So when we started talking to our community as community health workers and saying, yeah, these are the issues, what are we going to do, and asking for solutions, it really came down to our community telling us, you know what, it's going to take us to be in those positions. What can I do to be a part of the school board? And so it really turned into capacitation for community members, and these are lay community members, like people that don't have a job in any healthcare kind of setting or anywhere where we do social determinants of health kind of work, so like housing and all of that. And we started, there was no curriculum in Spanish out there that said how do you become a part of a board, or how do you become a mayor or a city councilor or any position of decision-making power. And so a lot of our community health workers got together to kind of build curriculum. We started with Robert's Rules of Order, which, to translate that, is so weird. Las reglas de Roberto. It makes no sense. People were like, who's Robert? Why are we doing this? Like, it's just so weird. But that was a really good starting point, and people were inspired. And then we started hearing of all these community members going out and saying, look, I'm a part of a committee now, or I ran for city councilor, and coming back to our group and sharing those experiences. And it's just been wonderful. So that's kind of where my work has kind of shifted, where we're helping Latinos be a part of all these decision-making groups, and not as a token, but it's been taking so much time to really teach people what it means and really relating it to something in their culture that they already know. So what's a mayor? Oh, well, it's like an alcalde in Mexico, you know, and kind of making those connections and answering questions. And it takes a lot of time and a lot of work. And I think that's the piece where it's really important to include our community health workers or promotores traditional health workers, health navigators. They have a lot of different kinds of names in different states. And now we have in Oregon our Community Health Workers Association that has a training to certify community health workers. So something to look into. Our proudest accomplishments. Gosh, there's been a lot of proud accomplishments, and I think most recently just being recognized as a Culture of Health Prize for such a rural community was such a big, I think we're always so caught up in what are we going to do next, how are we going to do this, that recognition was kind of a nice place for us to kind of sit back and say, oh my goodness, we've done a lot and we've come a long ways. But I think the thing that I'm most proud of is really the collaboration that happens, and it's true and genuine. And our decision makers, our CEOs, are really looking to our community-based organizations to ask all those important questions and to actively engage community members and community member perspectives through some sort of policy change or change in the way that they do business and the way that they do things. Sometimes it's really hard because we're talking about all these systems and all these rules that are already set in place. So some of the most recent examples have been plain language trainings. I think a lot of times, or it's true, our community members will come to us and they're like, I got this bill or this letter from whatever office, and yeah, it's in Spanish, but I don't understand what it says. And so having just those conversations with our coalition, with our community partners to say, these are things where you can affect equity in our community. What does it mean to you, and how can we work together? And I think that's the sexy word right now, equity. Everybody wants to be involved in anything that has to do with equity, and especially so our demographics in that area are mainly white, with 30 to 40% Latinos, and our kids in school are like over 65% Latino, like 0.1% African American, and like 1% Native American. So it's really interesting community, and I think just the collaboration and people talking to each other has been one of the biggest successes, among a lot of other things that I could talk forever about. But just everybody's involved, everybody's listening, and I think a lot of people are shifting the way that they think about things and really focusing more on policy change for lasting change. So yeah, that's it for the first two questions.